So this is one of the things that we use, which is the rule of 4. The brainstem took around 4 days for me to come. Okay, yeah. 4 days in a row. And then I had to practice it and redo it again and again and again. What I'm saying is it takes time. I did not get it the first time. I spent one whole day studying the brainstem. I woke up the next day and forgot everything. Okay, so then I had to do it again. The next day, I forgot everything again. So it took time for me to understand the concepts. Some of the things that really, really helped me was using this, which is the rule of 4, the boards and beyond video, and Dr. Nadeem. The thing about Dr. Nadeem, time, okay, about 13 hours for the entire brainstem, which is a lot, okay? But again, it's just for your understanding. If you did not get it through the slide, through Dr. Nadeem, you can use it as further understanding. You don't have to. A lot of us just stick to Dr. Nadeem, and it's fine. I do recommend all of you to go through boards and beyond brainstem. Okay, the last 4 minutes of it will explain to you the rule of 4, and literally it sums up everything for you and the whole concept. And after that, it's just apply it and practice. Okay, once you get the concept, it's stuck with you forever. Okay, it's really not that bad. Just stay with it and take your time with it, and don't listen to what your seniors are telling you in terms of it's impossible and stuff. Okay. Now the second thing that was kind of difficult for us to understand in neuro were the different tracks and how it crosses over and stuff like that. So because it tends to be confusing, because at one level of the central nervous system, if this gets damaged, this side of the body gets injured or has symptoms, and then if you go more up, it's the opposite side. It's confusing. What a lot of us did was we practiced on each other. Okay, so for example, we would trace each other's backs and then link it to the other side, or link it if, for example, on this side, there's this lesion, on this side, there's symptoms. One thing I did specifically was I drew the entire track, okay? I grabbed the board and just drew the entire track. And I have, okay, if I cut this section, what happens below it, okay? This helped me understand this concept a lot. So I recommend you guys do that, but again, take your time. If you don't get it the first time, it's okay, okay? Just take your time, stick with the slides, stick with the resources I told you guys about, and practice. Practice, practice, practice. Okay? You guys will have 3 anatomy doctors that will teach you the entire course. Dr. Yaqeen will be the major one. He'll teach you guys majority of the lectures, the brainstem, the spinal cord, the bigger lectures. Okay? Dr. Yaqeen will teach you guys anatomy in terms of he'll give you a clinical scenario. He'll teach you guys the normal anatomy, what happens normally, and he'll link it to what happens when things go wrong. So stick with that and know those details that he says, especially the clinical scenarios that he says, okay? Make sure you know them, because in the exam, the clinical scenarios tend to be written in that same order, okay? So know them pretty well. Know the key tips on each of the lesions that he's gonna tell you guys. The thing about Dr. Yaqeen is he tends to say everything in one slide and then discuss it again later on. And I know you already had one lecture with Dr. Yaqeen, which is the organization where he just talked about everything. Don't worry. Throughout neuro, he's going to revisit the same concepts over and over and over again. Okay? It's not the first time that you take this. You're going to take it over and over again. So don't stress out if you think it's a lot. It's going to be divided through lectures. Okay? Now, for the other doctors, you have Dr. Akif, who will teach you a few lectures. Now, Dr. Akif's lectures are just a few, but they're really not that bad. You just need to stick to the understanding, okay? Stick to his explanation. He'll explain it to you really well. He teaches you guys the brain, the blood supply of the brain, the meninges and stuff like that. It's really not that bad. Just stick to Dr. Akif's explanation. And make sure you attend his lectures, okay? You know what happened in Under Pro? Don't do that mistake again. Attend his lectures in there, okay? So the next doctor, which none of us actually had, was Dr. Vladimir. He'll teach you guys a few lectures, such as, I think you already had of him a bit. Okay. So we didn't really know what to say about him, but we interviewed him, and this is what he told us for you guys to focus on. Is come prepared and be engaged for his lectures, okay? And make sure you do as many practice questions as possible, okay? That was his biggest advice for you guys. Now, the second subject in neuro that I want you guys to study is physiology. Now, physiology, if you just look at it on its own, it looks kind of confusing, okay? There's a lot of just specific concepts in it. One of the things I did, which helped us a lot, was I linked it to anatomy. I studied the anatomy first, then I studied the physiology, or sometimes even study them together. For example, you take the spinal cord, you take the reflexes. Then, okay, what happens at a physiological level? You study the physiology level lecture on the different reflexes, okay? And you link them two together. You studied multiple lectures at once, okay? So that's something I did specifically, and it helped me a lot, okay? And just know the details that he explains it to you in the slides, because he does tend to focus on and stress on certain things in the lectures, okay? And these are the things that he sometimes examines you guys on, okay? Stick to the details that he mentions. And you don't need to use external resources at all for physiology, okay? Stick to the slides as much as you can, okay? And one thing is, below the slides, there are notes. You are not required to know the notes or look through them, but you just understand them, okay? If you need further reading to understand what the lecture's on, look at the slides, or look at the notes section. You're not required, you're not gonna be tested on it, inshallah. Now, pathology and pharma. You guys took pathology in POD, you took pharma in POD, okay? It's not like that. It's not like pathology or pharma from POD, okay? It's much more organized. Because in pathology, you just took basics of everything. You took different cancers, how it works, how inflammation works, and so on. Now you're applying it, okay? What pathologies happens in the central nervous system? What drugs do we use in these diseases that happens in the central nervous system? That's what you're gonna take. So it's much more specific. You're no longer gonna take, for example, these classes of drugs, and then this drug treats this disease, or this drug is used for this. You're gonna take all the drugs that are treating this disease in one lecture, okay? That's how you're gonna take pharma. For pathology, you're gonna have 3 doctors that are gonna be teaching you pathology in this block. For all of them, they tend to do this habit, which is stress on important concepts in their lectures, okay? Make sure you cover those points really, really well. Especially for Dr. Aban, and you guys already know Dr. Aban, okay? He does tend to talk a lot, so please just use a transcript. The other thing which I recommend you guys do from now on, which is from neuro onwards, is cover lymphoma before you study the lecture. The reason why I say this is because pathoma will teach you the basics of it, okay? We'll give you the big picture of everything that's happening in the lecture. Then you go to the lecture and you just fill in the gaps, okay? You look at what the doctor's stressing on, okay, I want to stress on this point, okay? And fill in the gaps. If there's no pathoma video, boards will be uncovered, okay? But pathoma is the most important resource for pathology from now on, okay? From neuro onwards. And practice. And you already know what resource to use for pathology in terms of practice questions, problems, okay? So make sure you cover it pretty well, because again, it's the same thing. For Dr. Ahmed specifically, I recommend Lipton Cup, okay? Because he uses the same picture there. Now, pharmacology, one of the big mistakes I did in neuropharma was I didn't really study it regularly, which kind of accumulated near that, okay? Study in a certain way, which I'll touch on later on, which is super important, but try not to stack up the pharma lectures, okay? Cover them as you take them, okay? And what do they focus on? They focus on mechanism, action, and side effects. What is this drug used for? How does it work? And what side effects do they have? That's what these lectures focus on, and majority of the doctors will test you guys on this, okay? There are a few points to touch on, which I'll get to. Sketchy pharma is important, okay? If you do like to use sketchy, and you do like it from POD, for example, from sketchy micro, use it for sketchy pharma. A lot of us used it, okay? And it was super helpful in memorizing everything. If you like to memorize through pictures, I recommend it. If not, then please do anything, okay, for pharmacology. So you just don't forget the drugs, its side effects, its mechanism of action, everything. Now, for the doctors who are teaching you guys pathology, you have 3. You have Dr. Aban, which you already know, so I won't touch on that much. It's the exact same thing. Then Dr. Ahmed. Dr. Ahmed has never taught you guys before. He is a really good doctor in terms of explanation. He will stress on concepts, okay? But the thing is he's teaching you guys probably the most difficult pathology lecture, okay? Which is central nervous system tumors. For that lecture, focus on the differences between the tumors, the age groups, when does this tumor happen, and the genetics. Dr. Ahmad specifically focuses a lot on the genetics, okay? So make sure you remember them. He stresses on certain things. Make sure you know them because he tests you on that specifically. Okay? We only had him once in Hem-Onc, and that's what he did for us. And don't come late to his lectures. Okay? Don't use your phone during his lectures because, yeah, it was a mistake we did, and please don't repeat that mistake. Okay? Then Dr. Shaukat. Again, I don't think he taught you that, right? Okay. So Dr. Shaukat is good. He has by far the best slides in uni. Okay. His slides are short, very short. Has all the information you need in them. Okay. And it's very organized. It'll include 1 or 2 practice questions in them. It's very good. And a summary slide as well. So all you really need is the slides for Dr. Shaukat. Okay. However, if you do want to listen to him, which I do recommend because he does stress on certain things again, to note them down, okay? And to focus on them while you're studying. And that's about it for the pathology doctors. For pharmacology doctors, you have 6 of them, okay? And you already know all of them, okay? There's not much for me to touch on. You already know what to focus on with Dr. Dana, right? Good, exactly, the green, okay? Stress on the green. Dr. Hattouf, she tends to focus on the differences between the drugs. Note them down and remember them because she does ask specific questions, okay? For the rest of them, they're pretty good. Just stick with them and you already know how to approach their lectures. Now for probably the big boss of neuro, clinical, okay? Clinical was difficult for all of us, unfortunately. The reason is the slides tend to be very complicated, 100 slides or so, and it's kind of confusing and has too much information. But not to worry you, it's not that bad if you follow a specific approach to it, which is take the main concept, okay? Take the main concept from the neuroclinical lectures. You don't have to know every specific thing in that lecture. You don't. Study pathology before you cover it, okay? Once you study pathology, you go to the lectures, half of the slides will be on the pathogenesis, which you've already covered from the pathology lectures. The other half are just certain information that you need to know, okay? Don't stress on too much on the management, which will be 30 slides or so per lecture, okay? You don't need to know them per se. Just take the main concept. What is this disease? How do you find this disease? And that's it, okay? If there's a pharmacology lecture on it, know the drugs used in this disease. That's it, okay? The thing I used for clinical, which made it super easy for me, was I use external resources, okay? And you need to use it. You need to use it for neuroclinical. And it helps you cover pathology as well. The resources I use are 2. Boards and Beyond, okay? The whole pathology course, as well as first aid, okay? I'll explain first aid later on in the slides. The next part, which is one of the fun parts of neuro, which is psychiatry. Make sure you attend every single psychiatry lecture, every single one of them. Dr. Ali Jalati will teach you guys psychiatry, and he's by far one of the best, okay? He'll make it fun. You'll laugh during his lectures. He'll teach you guys stories that happened to him, funny stories, funny jokes, everything, okay? And it'll make it easier for you to retain that information and to link it, okay? So you remember, okay, this disease is being tested, or you're studying this disease, you link, okay, he said this case about it, and it makes it easier for you to remember. Points to focus on in psychiatry are the differences between the conditions, such as depression, anxiety, and so on. You're going to know the differences between them, know how they happened, and understand the disease, understand the condition, and then also know a bit about the management, okay? Know, for example, when you have a patient who has depression, what to look at, okay, with this patient. Stuff like this. He tests us on this parts, okay? The next thing is defense mechanisms. The thing about defense mechanisms is it's scattered throughout all of the lectures, okay? So it's unorganized when you come and approach them. One thing I highly recommend is Boards and Beyond for defense mechanism. It's only one video, which covers all of them in one place, okay? So look at this either before you start psychiatry or when you're done, as a sum up of everything, okay? And if you want to better memorize the different DSM-5 criteria, which is how you tell the difference between the diseases, the symptoms, and so on, use mnemonics, which are all throughout the lectures, to include the mnemonics, or if you want it all in one place, first aid has them, okay? So that's it for psychiatry. Now for micro and immuno. Micro and immuno have about 4 lectures, 3 micro, 1 immuno lecture. They're not like POD at all. okay? This is when you're actually applying some of the stuff you learned in POD, the bugs that you learned in POD. Specifically, what bug causes this one is these two diseases that they're going to talk about, meningitis and encephalitis, okay? You need to know every detail in those lectures, unfortunately, because it is a bit difficult and the questions do tend to be low yield a bit, okay? So know Dr. Mohammed's slides pretty well. However, you don't need to use external resources at all. I don't recommend using external resources for micro at all. Just stick to the slides, okay? Stick to what she's teaching you and the points that she's telling you. So make sure you either attend the lecture or make sure you study the transcript pretty well. For immuno, it's a short lecture. It's only one lecture. It's just basically how the blood-brain barrier works. It's not that bad. Cover it when you take it and then just review it near the exam and you'll be fine for immuno, okay? If you want to practice, use Anki, and I recommend Anki specifically for micro, okay? So use Anki wisely. And the two doctors that will be teaching you are Dr. Mohammed, and just a note, Dr. Mohammed will teach you micro from now on, okay? All of the micro lectures from now and all of third year. And also Dr. Garvin, same thing. Now for labs, okay? You guys will have anatomy labs, you guys will have physiology labs, and I believe you already have physiology lab, okay? And then micro lab, okay? So don't take labs as going and learning something new, okay? Take it as a practice, okay? You go and you're just practicing the information that you learn. This does two things. You're covering the lectures beforehand, so you're staying caught up, and then you're practicing, okay? So the information is sticking to you. Make sure you cover everything before the labs. So in the labs, you're going to see clinical scenarios. Solve them with your friends and everything. Just understand the clinical scenarios because the exam will be structured like this, okay? Similarly to the clinical scenarios that they're going to give you. In terms of practice, if you do need practice, your lab committee will provide you with practice, inshallah. The mock exam by academic aid will, and also the review labs at the end, which you can go and you can link everything together, okay? Now, PBLs and TBRs, okay? PBLs and TBRs are every week, okay? You guys will take courses, you already took PBLs and POD, you know how it works. And then TBRs. TBRs are not graded, okay? It's just there for you to practice scenarios. Both of them are super important for what? SAQs, okay? Make sure you know the cases pretty well in both the PBLs and more even importantly, because that's what came for us at least, were the TBRs, okay? So know them pretty well. Know the concepts in them. Review beforehand what concepts will be tested in the TBRs or what concepts are in the PBL. And then at the end, just sum it all up by using, for example, PBL committee documents that are summaries, okay? For TBLs, they're graded. They tend to be easy, inshallah. Inshallah, it's easy for you guys as well. Just study everything beforehand that's coming in the TBLs, and then just take it as a practice session. If you get mistakes in the TBLs, don't worry, it'll be fine, inshallah. Just study everything that you got wrong or fill in the gaps afterwards, okay? So you guys are more prepared for the exam, inshallah. Now for the most important part of this presentation. I just threw a lot of things at you guys. 8 different subjects, what to use for them, how to study them, what's in them, it's a lot, okay? It's really a lot. How did I manage in neuro? This is the best advice I can give you guys, okay? Study it in a specific approach. Don't study it by subject, okay? So don't study anatomy, okay? I'm gonna finish all the anatomy lectures first, and then I'm gonna jump to pathology, then I'll go back to physiology. It doesn't really work that way, okay? The way that I did it, that helped me so much in neuro, and I still do to this day, which is something like this. I first study the normal, okay? This topic is on, for example, the brainstem. I study the brainstem anatomy. If there's a bit of physiology, I'll study that too, but I don't think there's a physiology lecture specifically on the brainstem. Then I cover, okay, what diseases can happen in the brainstem, okay? So the pathology. If there's bugs, what are microbes, okay? Lectures. Clinical, psychiatry, okay? These are the application lectures. Then I sum it all up by how do I treat it, okay? Which is through the pharmacology side. And at the end, I practice and apply all of it through practice questions, okay? And repeat for different concepts, not subjects. Probably is a bit confusing. So an example of this is something like this. This is how you actually apply it. you're going to take a lecture on the limbic system, which is responsible for all of your emotions, okay? Your memory. You're going to study the anatomy of it, the different structures, the amygdala, the whatever, okay? Then you're going to learn the physiology of it, okay? How does it work? The different neurotransmitters, the different signals, what happens with cortisol, for example. Then you're going to learn what goes wrong with the limbic system, which is through psychiatry, okay? Which is through anxiety, depression. Now, okay, you're studying psychiatry. You know what the diseases are. You know how to tell the differences between diseases, okay? You know how to approach the patient. What's the last question? How do I treat them, okay? Which is through antidepressants and anxiolytics, through pharma. This way, you covered a whole concept or topic at once, okay? Which are a group of lectures, rather than subjects, okay? This makes it easy to link them all together, rather than just studying random things at once, and then it's all just messy. This links it all up for you guys. Then practice through, for example, AMBOSS questions, okay? Another example, you're gonna take the brain, how the brain works, the physiology, the different signals. Then you're gonna learn, okay, what goes wrong with the signals? Epilepsy and seizures through clinical. Then, okay, how do I treat them? Anti-epileptic lecture, okay? This is how you approach it, through concepts, through topics, rather than through the subjects, okay? So please, please, please follow this as much as you can. Now, this is an example question. Can someone read the first underlined thing? Yes. Okay, why would I underline this? Okay. The reason why I underlined this specifically was Dr. Yaqeen, as I told you, will tell you guys clinical scenarios during his lectures. Okay. This is one of them. He says a whole bunch. Okay. I showed one of my colleagues yesterday just this question, and he got it just from that one. Okay. Just because these things happen in specific conditions or in specific cases. Then the last two lines, which are different symptoms. You're going to learn how the tracks work, what are the different tracks, when they cross over, and then you're going to learn what happens when it goes wrong. This is a perfect way to sum it all up. Okay? Does someone know the answer from third year?
What is that? E?
B. Okay, it is B. No. It's B. Basically, everything is damaged except the posterior tract. Okay, the dorsal tract. Everything except, I'm not going to explain it. Everything except the posterior tract is damaged. Okay. So the anterior cord. Okay. This is how you apply everything together. Practice as many questions as you can in neuro. They're very important that you go through them. Dr. Yaqeen will explain it to you guys specifically in things that come in USMLE.
Can you give us any other sources for practice?
Yes. So pathology, I already gave you Robbins. Okay. And also there's one specific resource for neuroanatomy, which is pretest neuroscience. Okay. Go through it. Okay. Go through it pretty well. AMBOSS is good. Specifically for neuro, unlike POD, it was probably really difficult. In neuroanatomy and neuro, you're going to actually start to know how to answer these questions. Later. I'll plug later on. Now, one other thing, which is step one, okay? So in neuro, I started to at least follow the concepts in neuro step one, okay? You don't have to at all. But I'm telling you, it helped me specifically in clinical and patho lectures, and also some of psychiatry. Dr. Yaqeen will give you a USMLE step one course. Attend it if you can, okay? A lot of us did well in psychiatry and neuro because we attended the course, okay? So make sure you attend them. They're gonna give you practice sessions. They're gonna give you questions. They're gonna tell you everything you need to know. It's basically a review lecture along with the lectures, okay? So as much as you can, if you can, attend them. If you can't cover any of this, it's fine, okay? Stick to the things that I mentioned to you guys earlier on, okay? As much as you can. If you do want to cover step one content at least, study alongside the lectures. Don't, for example, cram them all in the beginning or cram them all in the end. It's not recommended. Stick to the slides as much as you can in the lectures and what they're teaching you. However, if you want external resources, study alongside the step one resources. This is an example of one of the pages in first aid from my iPad. It's a lot, okay? It's a clinical lecture. Basically, everything in that clinical lecture is just here, okay? For me. So if you can, use it as much as possible, but again, you don't have to. If you don't, it's okay. It doesn't matter. Now to plug it in. Okay, so the MSA for Growth and Development, which thank you for having me today, and Academic Aid. Growth and Development will provide you guys with PAL sessions, okay, all throughout this block. I personally attended with clinical PAL sessions last year, and it was helpful for me, okay? So as much as you can, they're gonna have PAL sessions probably on anatomy, on clinical. So attend them as much as you can. They tend to be really good practice, and especially the question one that they might do with all the questions. Yeah, exactly. Then academic aid, which is my committee. So academic aid will provide you with mock exams, student guides, Anki, notion templates, everything you need, inshallah. Now I threw a lot of resources at you. All the resources you need are here. Okay, it's organized in terms of a table with each subject, with each concept, everything. Okay, and what videos you need to use for every single thing. You don't need to cover them all. Okay, cover the ones specifically used. However, they're there as an external resources in case you need it. Okay, are all of you good? Bring some the external resource, Dr. Najib. Okay, Dr. Najib, again, it's pretty long. So if you have time and you want further help, you can watch it. But again, you don't really need it. You just stick to Dr. Yaqeen. If you don't understand from it, go to Dr. Najib. Okay. Ninja Nerd also explains it. Ninja Nerd also has a few videos, 2 videos on clinical, which are epilepsy and the headaches, I think. They're pretty good. Okay. But again, you don't have to do it. And that's it. Please scan.